What is the role of your group within the IDEA4RC project?
Okay, so what we do at our group at Utrecht University, so we are social scientists and we work from what I call a responsible innovation approach, where we try to explore the perspectives of all different stakeholders, so all of those who may have a stake in the project at one time, or in the integrated data ecosystem, that we have all their voices heard, and also we want to create a dialogue between the different perspectives so that they are aware of the different ideas they have, but also about the different values that underlie their perspective. So if we talk about privacy, for instance, privacy has different meanings for different peoples, but also for when you are assuming different roles. So privacy means a different thing for me when I think about what I do as a researcher than when I think about when I am just a citizen or a mother. So that's important to be aware about that and to talk about that.
IDEA4RC focuses on rare cancers. Does the rarity of these diseases make it more challenging to understand and integrate patients' perspectives in the development of the ecosystem?
I think it can depend. So I think it is much more difficult to be able to collect sufficient data so that you can conduct meaningful and informative studies. But on the other hand, I know there are also lots of patient groups who are very active because they do need to raise awareness about the very rare conditions they are diagnosed with, and also to bring it to the attention of the public that, they are suffering, and investment needs to be made, and lots of effort needs to be put into developing the right type of treatment or into ensuring that care is provided that meets their very specific needs. I think IDEA4RC is also trying to ease in a certain way, if everything goes well, this particular burden by allowing medical researchers and clinicians to be able to access large amounts of data so that they can already develop studies or develop guidelines for care practices without requiring perhaps so much from the patients or partnering with them, but perhaps in different ways.
The project involves many complex topics. How do you gather the views of non-specialists on these issues?
So what we in many of these projects do is like we develop exercises where we try to evoke these different ideas about values like privacy in the assignment that we create for them, by not necessarily making it. We are not asking them about regulations or these kind of things, but we try to evoke what ideas and what values may underlie them, to then translate them back to what is needed. So we don't expect all participants to be an expert on every different field, but we try to at least get the dialogue ongoing.
Yeah.
And,
the first co-creation workshop will involve project members. What do you hope to achieve?
Well, I think the scope of this first co-creation workshop is quite ambitious because it includes indeed all the consortium partners, and they have different types of expertise. This makes it very interesting for us. So we have here with us today, we have technical developers, we have medical researchers, we have clinicians, legal experts, and so on. And these people also come from different EU member states. They also have different levels of familiarity working with each other. So this already allows us to map different interests, different approaches, different values that they might, foreground among themselves. So I think this already provides us with a very diverse set of people, also people who are very knowledgeable about this project, also knowledgeable in terms of the expertise that needs to be brought into this project. And I think already by ensuring a dialogue between them, by helping them become aware of what they know and what they do not know, because, regulations is something, for instance, as we mentioned earlier, that legal experts know a lot about, but, medical researchers or clinicians might be less informed and they know, of course, things regarding their own day-to-day practices. So I think already facilitating this dialogue, being able to understand what are the corners that are not covered currently in terms of existing knowledge or knowledge that might need to be added to their practices, is something very important. And I think also what this first co-creation workshop aims to do is to be able to map the main values, needs, and concerns of these different types of stakeholders, because they need to reflect upon them, and they also need to reflect on the tensions that might emerge between them. We mentioned already data privacy and security are very important values. But if they're actually, let's say, safeguarded through very cumbersome, time-consuming, work-intensive processes, then this is likely to decrease the convenience that potential users of IDEA4RC will experience, which might have a negative impact in their willingness to engage with it in their daily professional practices. So by making these consortium partners aware of the tensions between such values, by allowing them to consider potential solutions that can be implemented now in the early stages of the development of this intelligent ecosystem, we hope they are going to be able, or we hope to be able to facilitate the responsible implementation of this ecosystem later on, and to prevent some, how should I say, more complex or negative consequences from occurring by intervening in a timely manner.
What kind of workshops are you planning for the second phase?
We are thinking about different co-creation workshops at different sites, but the question is then if that really helps the project further, because it's so based also on the data sharing across centers. We are now thinking about different ways also to gather more in-depth information about these different processes ongoing in different places. So we were thinking, for instance, about having observations at different places, like being a more ethnographic study. But we were also thinking about, okay, maybe to raise awareness also from the different experts involved, we can also think about making them ethnographers for a day, so have them observe their own practices and then share this input, because they have access to much more relevant information and they know their daily practices. So that would be very interesting. So that is also a way that we are considering at the moment. So we basically also let the project help us evolve and design the next steps. So what is needed for the project and what info do we need.